My name is Caesar, and today I'm going to be doing wound care. So first, you want to check your PCP orders with the patient care plan, and then you want to gather all your supplies such as store water, gloves, uh, wound care tray, and etc. Then you want to enter your patient's room. Close the door, curtain, provide for privacy. You want to identify your patient using two patient identifiers. And then you want to introduce yourself. You also want to let them know what you're going to be doing. You don't want to just go in there and start looking for the wound. And then you want to also assess for any allergies due to tape, gloves or latex gloves, etc. And then you want to raise your bed to a working height. So first, when you go into your patient's room, you want to look at the site that the wound's at, and then you want to kind of adjust your patient. Make sure they're comfortable to where you could work on the wound nice. You want to make sure there's bright lighting because you want to look at the wound. Okay, so as mentioned earlier, that one's not working. As mentioned earlier, you want to perform hand hygiene. Okay, applying clean gloves. Prepare your stuff. So you can go ahead and open your stuff. I know most of these kits already come with a biohazard bag. So it all depends on your hospital. You could use a biohazard bag or a trash can. Like I said, it just depends on hospital policies. Okay. So you set that at the bedside. Not too much room to work here. Okay. So when you want to take off the wound packaging, you want to make sure you take all the corners off first, slowly, holding the skin taut. Okay. And then you want to make sure you take it off slowly. You don't want to pull the skin because that could just irritate or hurt the patient. You want to check for any drainage, color, consistency, amount, any odor. Fold this in half, dispose of it properly. Take your packaging off. If your kit comes with forceps or something to take it off, you could use that, or you could use as long as your hands are clean, take the packaging off. And same thing, you want to look at the gauze. You want to check for color, see if there's any drainage and what kind of drainage there is, consistency, odor. Throw that out. And you make sure you chart all that stuff. And then dispose of your gloves because they're dirty. Perform hand hygiene once again. And then you want to apply new gloves. Oops, that worked. Okay. Now for this part, you want to get some sort of waterproof pad in a basin or something so you could drain the water because you're about to clean it. So I want to put this underneath my patient. And let's say the wound is under the thigh, and it's, like I said, you want to make sure the patient's comfortable. You want to set the patient to where when you clean the wound, you're making the water come out. So you will get your store water, or you could check your PCP orders because some wound care is going to require you to use a certain amount of solution. Okay. Okay. So now, to clean your wound. So when you clean the wound, you want to clean from least You want to clean from least contaminated to most contaminated. So and then you want to make sure you keep the tip about 1 inch above. And you want to make sure you do single strokes. So just like this. You want to go back and forth a few times till it looks clean. Single strokes, there you go. Okay. So now that I'm just going to set that down for now. So now that my wound is clean, can set this down. You're gonna reuse that later. You could grab some dry gauze. Like I said, all this is in your kit. Dry gauze, and then you want to pat it dry. And saying when you clean, you want to go from least contaminated to most contaminated. If it's water inside the wound, you can also pat inside lightly. Okay, dispose of this properly. After you're done cleaning it, same thing, you want to remove gloves, perform hand hygiene, and apply a new set of gloves. Just because you were touching the wound and it could be dirty. Okay, I will then grab my measuring tape. And when you measure, you want to measure length, width, and depth, because that's the way you want to chart it. And then you also want to measure, let's just pretend that they fall on the floor a bit. I will have multiple of these just in case, you don't want to pick it up. I will dispose of this and grab a new one. So you want to measure in centimeters, so my wound would be 12 centimeters. So you could either chart that if you have a computer open, or you could write it on paper. Make sure you don't forget that you want to measure the part with the width that is the longest. So mine would be about 2.5 centimeters. And then you could use a cotton tip to measure the depth. You're just gonna estimate by putting your finger at the deepest part. Okay. So we'll mine's close to 2 centimeters in depth. Okay, so you wanna dispose of all this since you used it. I will take my glove off again, perform hand hygiene, and apply a new set of gloves. I don't want to put it first. Okay, so now when you're packing your wound, it's already dry, we already measured it, all that good stuff. You want to irrigate your gauze. Okay. And then you could take all the excess water out, and you want to make sure that you don't want to roll it up because you want the wound to breathe. So you just want to kind of open it up and fluff it. And you can just kind of insert it. You can use cotton applicator to. And if it's tunneled, you want to make sure you get it in the wound as much as you can. Same thing, you want to drain, open it up, drain all the excess water out. You want to make sure you fluff it. No, make sure. Use a cotton applicator again. So depending on how deep and how big the wound is, you could use 1, 2, 3, 4, 5. It just depends on the size. For this one, looks like it's gonna be a good 3 or 4 pieces of gauze. Same thing, fluff it. Put it in there as you can see. You also want to make sure that the gauze is not covering the edges because you want it to heal. So you don't want all that gauze on the edges. And here's my 4th one. Looks like I'm gonna use. Drain all that excess. Make sure it's fluff. Okay. Nice. And you want to make sure it's nice and even. So at this point, I would take off my gloves and perform hand hygiene once again. I think I changed my gloves too many times, but that's okay. Okay, once all this is nice and stuffed in there, you want to grab some dry gauze, if I have any. So I'll usually use about 2 pieces of gauze. Apply them on there like this. Then you want to use your ABD pad. Make sure the blue side is up, just in case there's excess drainage. There we go. Then you can see the line change color. And this is where you use your tape. take the edges down. Okay. And then when you're using tape, you also want to ask the patient, like, I mentioned earlier, ask them if they're allergic to certain tape, because there's certain tape that will give patients an allergic reaction. Okay, so there we go. Making sure you don't put pressure on here, just kind of tape it around, nice and clean. And then after you're done doing that, you want to make sure you put your initials, the date, which I believe today is the 7th, so 4/7, and you can also put the time, 1300, like that. The next shift or staff or whoever knows at what time. So initials, date, time. Okay, you wanna take off your gloves, perform hand hygiene. You wanna make sure you set your patient back at the lowest position. Make sure the call light is within reach. You can also, ask the patient if they need anything and when you will be coming back. Once all that's done, you go ahead and chart. Make sure you chart per facility protocol. The procedure, how will the patient tolerate it, if there's any changes in the wound, any excess drainage, any infection that might be present, all that good stuff. Chart everything, and you're good to go.